Hi, Dr. Robert Levine here from Genesee Community Health Center, here to help keep you informed about COVID-19 and about your health. So today I want to talk to you about testing. A lot of folks, as testing ramps up, a lot of folks are being tested. There are two basic types of tests for COVID-19. One is the nasal swab everybody's seen on the news. That's where they take a Q-tip and it goes into your nose, and they soak the swab with some of this mucus from your nose, and they send it in to find out if you have a virus in the mucous membranes of your nose, in the snot, if you will. If you're shedding virus, they'll be able to tell, and it will be reported back to you. The other kind of test is actually a blood test. The blood test tests for antibodies. It's called serologic testing, and it's a blood test to determine if you've been exposed to the COVID-19. Doesn't tell you necessarily if you've got it, but it's all quite confusing because it is symptom dependent. And what that means is, when you had the test, did you have symptoms? Did you have achiness? Did you have fever? Did you have cough? Did you have some sort of symptoms? And it's very hard to figure out what testing means, and a lot of times it's difficult to get a hold of your doctor or healthcare provider. So I've created a grid that I think will be very helpful. If you want to hit pause when I hold this up, and you can take a snapshot of this grid. It's available online. We're posting it at the Genesee Community Health Center. And what it has here is every scenario of testing. One is the nasal swab testing, and the other is the blood testing. And it tells you what you should do and what the interpretation is for tests. For the nasal swab test, whether you have symptoms or don't have symptoms, and for the blood test, symptoms versus no symptoms. So this should help you sort it out. I'm not going to go through each one of these because it's self-explanatory, but I hope that can help you. And if you have any questions, of course, you can call the Genesee Community Health Center and talk to your provider. And if we're not your provider, we can become that. Thank you.